In this third installment of my bandaging series, we are going to talk about follow-up care and owner compliance. Yeah, I get it. Not a very exciting or sexy topic at all, but so important. Good follow-up care and owner compliance is how we are going to avoid bandaging disasters. So please take notes, take screenshots as we go along so that you can create your own bandage care protocol for your hospital and your staff, and so that you can create a handout and very detailed information for the clients to be able to take home and understand what their role is in taking care of their pet's bandage. Let's start with what the owner needs to know. First, they absolutely have to make sure that bandage stays dry. So if there's any dew on the grass, maybe put a plastic bag over the bandage while the dog is outside. And just an extra consideration for male dogs that have a bandage on a forelimb. Some of them just seem to pee right on the bandage all the time. So maybe they should always have a booty when they go outside. There are commercially available booties. So if you are dealing with a patient that you know is going to be bandaged long term, maybe you got a big wound or you're dealing with a fractured limb and they're going to be splinted for about 8 weeks, you may want to send your client to a pet store where they can buy these booties. This one's made by Medipaw. There are other commercially available booties out there. They just make the job easier. And just remind clients that plastic bags, booties should be removed when the pet is back in the house because they will sweat from the toes and that will create a bit of condensation within the plastic bag if it's not removed. If the bandage does get wet, this needs to be stressed that they must come in because a wet bandage will lead to dermatitis and wounds. If a bandage gets wet, significantly wet, and is allowed to dry, it will often constrict, it will get tighter, and that can be a big problem for the patient's limb. Get your owners to check the bandage twice a day. They are looking for wetness, moisture in the bandage. They're looking for slippage. Maybe the splint inside the bandage has shifted. That is the kind of thing they're looking for. They're going to want to look and touch the bandage. They're also going to want to check the toes for swelling. The way they will determine if the toes are swelling is that there's going to be moisture between the toes and they're going to see that those two toes have separated out more than normal, just like the picture that you see to your right. If the bandage is new, they should check for swelling in the toes every 2 hours in that first day that they take their pet home with the new bandage. If everything's okay, then they can just check the toes, twice a day at the same time as they're checking the bandage. If there is moisture, slippage, swelling in the toes, they need to give you a call and or bring the pet in for a bandage change. I know there's a bit of repetition here, but these points are so important. The owners need to call and preferably come in if they notice that the bandage is smelly, if it has shifted, if it has slipped, if it's wet. Any of those issues, they shouldn't ignore them. They need to take action. Also, if the patient just shows a change in behavior, so they're chewing the bandage, but they didn't chew it before, or they didn't chew the previous one. Maybe the dog's using the limb less. Maybe the dog is just less enthusiastic about everything. The energy level is down, a little depressed. Maybe the dog is panting and whining a lot. These can all be indications of pain, discomfort, and the dog should be brought in immediately. Note in the picture this bandage that was removed from a dog. Clearly, the bandage has been chewed. This is not the patient's first bandage, but he chewed right through this one, and you can see there's a bit of discoloration in the bandage that's been removed, and he was in fact forming a decubital ulcer. Yeah, It's a summary slide. I know there's nothing about this talk that's really sexy, but it is so important. So, what does the client need to do? They need to keep the bandage dry, check the toes and bandage daily, and call or come in if there are any concerns. Your job is to make sure they understand exactly what all of that entails. So, what are your duties at the hospital? What is it that you need to make sure that happens? Let's move forward. So, your job is to make sure that you check and preferably change the bandage on a weekly basis. 1 week should be the maximum amount of time that you leave this bandage on because you're going to start to see problems when they're left on longer. All right, so see your patient every week. I know it sounds frequent, but trust me on this one, every week. Clearly, you're going to want to change the bandage sooner if you are dealing with a fresh wound, right? This wound just happened. You may want to change the bandage every 24 hours or 48 hours in the early stages. Also, if you're applying the bandage for an orthopedic reason that just happened and there's a lot of swelling, well, once that swelling goes down within about 48 hours, your bandage is going to be loose and maybe not function as well. So you may want to change that bandage more quickly within maybe 48 hours rather than wait a whole week. When the patient comes in for a bandage change, you should have a list of things that you want to check on every time to make sure you don't miss anything. And I know this may sound a little tedious, but trust me, if something is starting to develop, you want to get it early and nip it in the bud. So you're going to check the entire limb thoroughly for any skin lesions, any wounds, any beginnings of a decubital ulcer. You might just be seeing something like the hair over the point of the elbow or the calcaneus. These are common areas for decubital ulcers. You might notice that the hair is getting rubbed raw. We don't yet have a decubital ulcer, but if you were to leave this bandage on a little longer, you would. So pay attention to that and modify your bandage accordingly. If you're seeing the beginnings of a decubital ulcer, add a donut, for instance. And you also want to check between the toes because, man, these guys, they like to get a lot of yeasty type of issues between the toes. Very understandable. So have a good look for interdigital dermatitis as well. Check the limb thoroughly. I want to share the story of this little dog that presented to us. He is about 10 to 12 days after the application of the original bandage here in these pictures. The bandage had gotten wet and the owners, didn't come in at that time. And we removed the bandage. It stunk. And look at the wounds on the lateral aspect of this poor dog's leg and the picture on your left. You can appreciate that it looks like the skin is just rubbed off. And the interdigital dermatitis was really angry and horrific, and you can see that there's some wounds just starting to develop on the dorsum of the paw as well. The picture on the far right is on the medial aspect of that dog's limb, just above the elbow where the bandage topped out, where it finished. And he's got this cut that you can see is right into the muscle, and that is just created by the bandage. This had to hurt. This poor little dog. I just feel so bad when I look at these pictures. This dog had to suffer through this. So clearly we tended to everything. We adapted our bandage so that the wound on the medial aspect of the limb would heal properly. And we had a really long talking with the client. So we're changing the bandage weekly. When you remove the bandage, you have a really good look at that limb for any problems that are thinking of developing or wanting to develop. And then you're going to do the following. You're going to clean between the toes and around the toes, around the pads. Use water and soap. Get those toes nice and clean. Try to get rid of any, yeasty issues that are trying to develop. Dry between the toes thoroughly. Our techs, some of them love to get the blow dryer out and get everything nice and dry, or if they could, they'd leave the bandage off for a little bit. They would use some talcum, some powder to help dry. Cut the hairs on the paw as well, because that's just going to help to keep the debris, some people like to call it toe jam, down, and help keep that dermatitis down a little bit. Address any wounds, any decubital ulcers that may be starting to form or have formed, and modify your bandage accordingly. So consider adding a donut if necessary. Well, we've talked about how we, as the hospital, are going to be managing this bandage, all the instructions that we've given the owners, and we've made sure that they understand the instructions clearly. But how do you get the owners to really be compliant, to really participate? That is a definitely $1 million question, and I don't necessarily have all the answers, but over the years we have come up with a few things that seem to help get some better owner compliance, and I'm just going to share some of those items with you. We found that owners tend to come on a weekly basis if we book their next appointment before they leave the hospital from this particular bandage change appointment. Makes total sense, right? They don't have to think about it. They're right there. They're in the mode. They just book the appointment. If they walk out without an appointment, by the time they think about it 5 days later and they give you a call and they check their calendar, you have no more appointment slots open. So it really doesn't work. Also, if the client doesn't show for that follow-up appointment, do not let it slide. Call them, text them, email them, do whatever you need to do to make sure that they understand that this is really important, that you're concerned and you want to make sure that the pet comes in for a bandage change. Also, I would advise that you record all these reminders in the patient's file, because when they do finally show up 2 weeks later and the limb is, halfway falling off, you want to make sure that it is in the file, that you did everything you could to get them back in. Every time your client leaves with a new bandage, you re-educate them. You remind them of what they need to do, and maybe you share some photos and tell a story of a dog whose, bandage wasn't changed in a timely fashion, to make sure that they understand how devastating it can be if you end up with a problematic bandage. Feel free to use some of the pictures that I have in this video, to help convince your clients. We also found that one of the things that was helpful was to have what we called a bandage package. So on our patients that we're going to be dealing with long-term bandaging, so maybe a fracture that was being splinted or a wound that we knew was going to need, 6 to 8 weeks or maybe more of bandaging, then we offered a package to the client. They would pay a one-time fee right up front, or 50% at the beginning and the rest later on. And then every time they came for a bandage change, and even if they needed, an extra bandage change during the week, they didn't have to pull out their credit card every time. It just made it easier, and this was all prepaid, so they were also more likely to maintain all their appointments. So we found that to be very helpful. I hope you found the information in this talk useful and practical, and that you're going to use it in your clinic. And if you have, please give me a thumbs up and subscribe to my channel.